Hello, good afternoon, good morning, or good evening from the World Health Organization headquarters in Geneva. My name is Alexandra Kuzmanovic, and today I am joined by Dr. Maria van Kerkhove. As we announced, Dr. Mike Ryan was supposed to be here with us. He had some unexpected duties, and he may join us if he finishes the other duties in time. But Maria will be here as usual to answer your questions about COVID-19. So if you're watching us on Twitter, please use the hashtag AskWHO. If you're watching us on other platforms, you can use the comment section to send us your questions. Maria, good afternoon.
Hi, Alex.
Thanks for your time today. We could see that we're seeing some positive change in the COVID-19 cases trends around the world. So is this decreasing in all regions or only in some parts of the world? And can we finally see the light at the end of the tunnel, or we are not there yet?
So thanks, Alex, for having me back. We are seeing some positive trends. I need to balance my answer here with the positives and the negatives. I think, we're very much in the middle of this pandemic still, unfortunately. I know all of us want to be out of this, but we're not quite there yet. We are seeing some positive trends in terms of reducing numbers of cases at the global level. We have seen some significant declines in all regions except Europe. In fact, in the last week, Europe had a 5% increase in cases. So the situation is still incredibly dynamic. And it's dynamic because we don't have control over this virus. And that's sort of the main factor of what we're seeing. Last week, 3.1 million cases reported to WHO, and that's of the ones that we know about. We still do not have good testing around the world. So there are probably significantly more cases that are occurring. But it's not transmitting at the same intensity in every country and in every city. I know some people are watching are probably living in cities where transmission seems under control, societies are opening up again, but in many parts of the world, that's just not the case. In terms of deaths, we have seen, again, a reduction in deaths at the global level. But more than 54,000 people lost their lives last week. We do see reductions in deaths in all regions except the Americas and in Europe, where we've seen a slight increase again. Again, it's really fragile. So at a global level, positive trends in terms of reducing numbers of cases and reducing numbers of deaths, but we're not out of the woods. We're very much in the middle of this pandemic. Where in the middle, the beginning of the middle, or the middle of the end, we're not quite sure yet. Because, frankly, we're not using the tools that we have right now to get us closer to the end of that pandemic. And those tools are vaccines, and not just vaccines, but vaccination, in the arms of those who are most at risk. It's about using the tools, simple measures. Wearing a mask these days is a simple measure. They're widely available in terms of medical masks, in terms of the fabric masks, that many people are producing, the 3 layers. We know what to do. Distancing, improving ventilation in the buildings where we live and we work. These are measures that take investment, but they're measures that save people's lives. So dynamic situation all around. Our sit rep tonight will give an overview of that breakdown at the regional level, but it's still quite dynamic.
Thank you, Maria. You mentioned that sadly over 54,000 people lost their lives in the past week. So why some people, even despite those terrible facts that people are losing lives, why do some people think then that the pandemic is over or it's towards the end?
Yeah,
where is that feeling coming from, in your opinion?
It's a great question, because I think a lot of people think, we're out of the woods, like this is over. We're reaching almost 5 million deaths at the global level. And again, that's likely to be a significant underestimate of the true number of deaths throughout the course of this pandemic. The deaths are happening largely among people who are unvaccinated. It's hard to get that specific data in every country, but from the countries that are providing that information, the rate of hospitalization and of death is by far, really among those who are unvaccinated. And this is because either people do not have access to the vaccine, So especially people who are of older age, people who have underlying conditions of any age, these are people that WHO prioritizes for the vaccines, the safe and effective vaccines that exist, that are out on the market. And they're not reaching those individuals in all countries. So hospitalizations and deaths are happening among unvaccinated individuals. And that's one of the reasons. The other reason is that we are seeing this virus transmit in some places out of control because we are not using the measures to suppress transmission. Now, that does not mean lockdown. It means the physical distancing. It means working from home if you're feeling unwell. It's about improving ventilations. It's about wearing of a mask. It's about clean hands. All of those measures continue to have an impact. So what I struggle with, and I'm not sure about you, Alex, what I really struggle with is in some cities, we see ICUs and hospitals full and people dying. Yet on the streets, people are acting as if it's completely over. That dichotomy is really strange to me. And maybe because I just sort of live and breathe this every single day, and we kind of see this at a global level, but we can't have that. You can't have it both ways, where you have everything opened up, and you have everybody living and pretending that this is over, while you have your ICUs full. So again, what we need to be able to do is to do both. Bring morbidity, the sickness, the illness, the severe disease and deaths down, and we can do that with the vaccines that are available. They just need to be prioritized for those who need them most. And this is what vaccine equity is all about, what COVAX is doing, what WHO and partners are trying to do. But at the same time, all of us have a role to play in reducing transmission, even if we are vaccinated, to continue to adhere to these simple measures: physical distancing, wearing of a mask, cleaning your hands, staying home if you're unwell. These are things that over the last 21 months, all of us have figured out a way to do, not without cost, because of course it's still challenging and it's really hard to keep saying to keep up these measures. I recognize what I'm saying, but these are things that all of us can do. But you can't have a completely open, bars full, people pretending it's over, and at the same time have your ICUs filled. These people are dying, and they don't need to be.
Thank you, Maria. Here's a question from Mark, watching us from the US on LinkedIn. Are there similar patterns among places showing negative trends? I assume the places where we see increased transmission and hospitalizations.
Yeah, so that's a good question. Yes, we see several different types of patterns in terms of transmission across many countries. There are some countries that have had these repeated waves. So if you've seen the EpiCurve, which is basically tracking the number of cases that are reported each day, you see these peaks and troughs and peaks and troughs. And some countries have experienced that because they've implemented a series of comprehensive measures. A lot of people like to call this the Swiss cheese, all of these different level measures. We call it a comprehensive approach, but it's a layered approach. And maybe a variant has been detected. So South Africa is a really good example of this. They brought transmission under control after their first peak. And then they had the beta variant that was identified in South Africa through amazing genomic sequencing that was done in the country. Then they used they implemented the public health and social measures. They implemented some movement restrictions for individuals while trying to get the vaccine out as best as they could. They brought the beta variant wave under control. Now they've just gotten over the Delta variant increase in transmission. It's about how countries and governments are applying this comprehensive approach. What we do see where outbreaks spread out of control is a very rapid lifting of all measures all at once. So what we've been recommending since the beginning is to, if you implement measures, implement them in a layered approach, but just as you implement them carefully, you release them carefully. And you use the data that you have in terms of transmission to release different measures in a controlled and in a staggered way. Lifting everything all at once gets us into this yo-yo of an all or nothing. And unfortunately, what we don't want to see are lockdowns. And we never recommended lockdowns, but countries have had to use them as a blunt force instrument to really bring transmission under control. So countries that are doing well, are navigating this challenging period of using the measures that they have, trying to keep transmission down, getting vaccination out, using vaccination more efficiently, making sure that communities understand where transmission is occurring, making sure that there's clear communication that they still need to be wearing their masks, they still need to be avoiding crowded spaces. If there are gatherings that are held, that they're held in the safest way possible. There's no zero risk, unfortunately, right now, and that people are well informed. It's a constant struggle, I would say, for people to kind of keep the message consistent and clear because it's such a dynamic situation.
Thank you very much, Maria. There's been a lot of discussion at the moment going on social media and in general whether this virus is to stay with us forever and whether these changes in trends are showing that we are moving towards endemic. So maybe you can explain to our viewers what does that mean and what would that mean if we move from pandemic to an endemic?
Yeah, there's a lot of discussion right now about this sort of switch of going from a pandemic situation to an endemic situation. And so it's a really good question. We internally are having a lot of discussions about what will the pandemic look like in the next 3, 6, 9, 18 months. In my own mind, I'm thinking between now and sort of the end of 2022, where that's the time, and it's going to take that time to get the vaccine rolled out and the vaccination in the arms of those who are most at risk. And that will change the dynamic of the patterns that we're seeing right now. But the option or the possibility to eradicate this virus or even eliminate this virus at a global level was lost very early on. And it was lost because we didn't at a global level sort of attack this virus as strongly as we could. And it's a challenging virus. It's brand new. It's a completely susceptible population. It transmits most amongst people who are mild or even asymptomatic. Those are real challenges for control. And there are some countries that are still following an elimination strategy, some island states, but that's very, very difficult to maintain. So the virus may become endemic, but endemic does not mean that it's transmitting at the same level that it's transmitting right now at this level of intensity. We're not in a state right now where it's endemic. We're still in the middle of a pandemic. But endemic can mean, that it's transmitting at a lower level, lower than expected. Now that's a hard thing to define right now. But in a specific geographic area where we see flare-ups among people who are unvaccinated, people who are vulnerable. And this is what I see going forward. I see us bringing this pandemic under control where we reduce morbidity and mortality significantly, where we can take the death out of COVID-19, but we will still have pockets of individuals who are not vaccinated for either because they don't have access, they refuse, or they can't be vaccinated. And we can still see flare-ups, outbreaks of this virus. But endemic does not mean that this virus is not dangerous. Endemic does not mean that we give up. And so that's the narrative that I'm seeing in the public that really concerns me, that if and when it becomes endemic, that means we give the white flag and we say, it's here with us to stay. Will the virus be with us to stay? Yes. And I think we are all doing that. I struggle with the phrase learn to live with, because to me that indicates some level of sort of giving up. But that's not what's, many people use that phrase as. It's just how do we balance, reducing that transmission, living our lives, and at the same time reducing the death. So I can see that future going forward, but there's a lot of discussions that are underway around what this pandemic will look like. And we're thinking in scenarios. If vaccination remains at the same level, if production changes, what will that change in terms of access? If countries can actually get access to it and roll out the vaccination programs. We're also looking at studies that look at seroprevalence. So what is the level of antibodies and protection in the communities right now? We have great work that's ongoing at global and regional levels. We're working with a group called SeroTracker out of Canada that's helping us track these and analyze this. Putting all of that information together, plus the use of these tools. What will the next 3, 6, 9, 18 months look like? So it's a long-winded answer because it's not a short one, unfortunately. It's just we're trying to get out of this phase where there is no predictability, where, we regain control, we get some control over this virus. So I think we're moving towards that, and I think many countries are moving towards that. But having two tracks of a pandemic where you have the haves and the have-nots does not help.
Thank you very much, Maria. We received some questions as well from viewers as you're explaining what's happening and also whether we live or how we're going to live with this virus, is about schools. And one question was, what is WHO's opinion about starting schools with poor and not controlled ventilation?
So it's also a good question. We always get really good questions during these live Q&As, which I know is why we do them. So thank you for sending in your questions. Many schools around the world have been opened and have opened safely with measures in place. We've been working with UNESCO, we've been working with UNICEF to outline guidance to open schools in the first place, because schools are so incredibly important for children, for their education, for their safety, for their well-being, and in many situations for the food that they receive, throughout the day, to not only open them, but to keep them open. So ventilation is one of the aspects that we recommend improving, not just in schools, but across all buildings. So ventilation is really important of looking at that. And in many countries, it's about making sure that there's a good cross flow. It's as simple as opening windows, where it's safe to do so, especially with younger kids, of course, making sure that their safety is there. But it's about disinfection. It's about distancing where you can. It's about the use of masks. It's about vaccination among the adults, that are there. And I know there's a lot of discussion about vaccinating children as well. But it's comprehensive measures. And it's about the plan. What does the school system, what plan do they have in place to inform children, to inform their parents, to inform the staff about what to do if you have a potential case, if you have a real case? How do you carry out the contact tracing? But all of this is wrapped up in the fact that schools are in communities. And so our main message has always been, if you can control transmission in communities, you can control transmission within those schools. Children, we've known from the start, children can be infected. Luckily, still, most children that are infected with this have a mild form or asymptomatic form of the disease, but it's not universal. Children have died from infection. And so there's a lot of different ways, but ventilation is an important aspect, as it has been, in all of the different places in which we live, in which we work. So there are ways in which ventilation can be improved in schools.
Thank you very much, Maria. And I think it's important to remind our viewers that there are still communities where schools are closed.
Yes.
Due to high transmission. So another reason why we need to actually use the tools you mentioned or distribute vaccines more equitably. And speaking of vaccine equity, maybe we can just remind our viewers about the targets that WHO has set for the world, including the target for end of September to vaccinate 10% of people at least 10% of people in every country. And unfortunately, due to vaccine inequity, 56 countries didn't make that. So what are the consequences that we can see or we're going to see if we continue with this inequity trends?
I mean, we see the consequences now. Not meeting that target is really, it's heartbreaking, and it's more than heartbreaking. It's more than frustrating. It's beyond words, I have to say, because if we had used the more than 6 billion vaccines that have been administered to date differently, we would be in a very, very different situation right now. There's no reason why we shouldn't have met those 10% targets in all countries. And I think that's the point I want to emphasize of what you said. It's not 10% of the world's population. It's 10% of the population in every country. And so this is why we have been fighting with our partners around the world, why the Director General has fought and spoken every day about vaccine equity, because it's about making sure people have access to these tools, to these life-saving tools. So the consequences of this are people who are not vaccinated are dying. We see very, very clearly in the data a separation between cases, hospitalizations, and deaths among those who are vaccinated. It is very, very clear that the vaccines that are available are safe and effective, including against the Delta variant, and they save lives. They prevent hospitalization, so they prevent people from developing that severe form of the disease to require hospitalization, and they prevent people from dying. It's astounding that we have these vaccines, this quickly into a pandemic. It doesn't mean that they have not gone through the incredibly rigorous trials that need to be done to evaluate their safety and efficacy. But these vaccines, they work. They just need to be accessible to those. So the result of this are people who are dying unnecessarily.
Thank you, Maria. In few weeks ago, you were talking about 5 factors that are driving transmission, and one of them that you mentioned is misinformation. So here is a question from Cheryl Morin, watching us on Facebook, saying that, actually this is not a question, it's a comment, but maybe you want to add something. We need to battle misinformation, which honestly is largely to blame for lingering of this, I assume the virus and the pandemic.
Misinformation and disinformation, so the misuse of information purposefully, is having an impact on this pandemic. It's prolonging this pandemic. And it is resulting in people dying. I mean, there's no way to sugarcoat that. So there are a lot of people that are working to address misinformation. All of you who are watching have a role to play in this too. Look at the information that you see and think twice before you send that to somebody else. Make sure that it comes from a reliable source. And if you have a question, find out. I mean, there's amazing access to really good information right now. You can come to the WHO website. You can go to the national authorities in your own country, but ask. But don't send that message. And there is genuine confusion out there. So there's a difference between misinformation, disinformation, and confusion. And so I do think that because there's so much information that's out there, that people have genuine concerns. And that's fine. That's good. You should question. But make sure you get that answer from a reliable source. But those 5 factors are still the same. So it's misinformation and disinformation is fueling this pandemic. Vaccine inequity is fueling this pandemic. The fact that we have the inappropriate use of these simple tools of the public health and social measures is fueling transmission. The fact that a lot of people are mixing, they're increasing the number of people that they come in contact with every day while not using those simple measures, those public health and social measures. All of this is fueling transmission. So it isn't just the Delta variant. The last factor are these variants, right? And you know, the virus is evolving. These are more transmissible virus. Those 5 factors are fueling this pandemic, and it's prolonging the pandemic. So this is just, it's morally, it's ethically, it's economically, it's epidemiologically wrong.
Thank you, Maria. And here's the next question from someone watching us on LinkedIn. How to deal with mental and psychological impact of COVID? On Sunday is World Mental Health Day, and we all know that this pandemic has taken a high toll on all of us and our mental health. So what is your advice? I know this is not your expertise, but
it's not my area of expertise, and it's such a challenging topic. I mean, everyone is struggling right now. So get help. I mean, that's what I can say is ask for help. Talk about it as much as you feel comfortable, but please reach out, because all of us are going through this. So whatever you're comfortable doing, know that you are not alone. I mean, you know, we can all speak personally of how we've been challenged with this. We all have family members who are really struggling with all of this, but just reach out. And there are a lot of services that are out there. There are a lot of tools that are out there that can help you cope, or at least help you try to make sense of what is actually happening. I know we have a lot of things that are planned, you know, that are coming up for this, but reach out, and please know that you're not alone.
Thank you, Maria. Here is a question from Balwinder Singh, watching us on Facebook. What about next steps, I assume, in fighting this pandemic? He says that people don't seem to be bothered about this virus anymore. I think we spoke about it a little bit earlier, but what are the next steps in your opinion?
I mean, you should be bothered by this pandemic. I mean, I think all of us are bothered by this pandemic. It's not over. In no uncertain terms should there be any ambiguity in this response. This pandemic is not over. And there are tools that we have that can keep you and your loved ones safe, and they can keep people alive. We have to get through this. We will get through this. And so what we talk about is sort of staying the course. That doesn't, again, I'm going to say, it does not mean lockdown. It means using simple measures. You know, be smart every day. Know what your risk is where you live, because it's so dynamic. And take measures to lower your risk every day. What you can do in your own communities for sharing good information and showing that we're all in this together, continuing to wear your mask. It's not a political statement. None of this are political statements. All of this, our fight is against the virus. Our fight is not against each other. And what you can do to fight for vaccine equity, do it. Whether it's writing to your leaders, whether it's advocating for this, whether it's making a donation, please please be a part of the response and be part of the solution. And that's from little kids to the oldest adults, anywhere in any profession that you have, for workplaces, schools, healthcare facilities, and again, a special thank you to all of our healthcare providers around the world who are working under extreme situations and completely burnt out. Play your part. Do what you can. Every step that you take to get us towards ending this pandemic gets the world one step closer to ending this pandemic. But we can't just pretend it's over. We can't just act as if it's over when much of the world right now is on fire. So do what you can, please.
Thank you, Maria. And here's one question about mass gatherings and sporting events. So what is WHO guidance and opinion about organizing some mass gathering events at the moment?
So what we do is we take case by case. So we look at the situation. So it depends on how much virus is circulating in the community. What we have outlined is a risk assessment. So essentially, when there's an event that's going to happen, there's a risk assessment is done. What is the event? Where is it taking place? How many people will be there? What is in place in terms of either testing or vaccine requirement? What is in place in terms of ventilation, mask use, etc.? And then there's an assessment that is made. And so what is done by the organizers is, number one, should the event happen? And in many situations, unfortunately, it shouldn't right now. But it depends. But in some situations, you can have these gatherings in a safer way if you put provisions in place. I would advise all of you who are considering to attend an event is to look at what's in place and look at how you can do it as safely as possible, or don't go. If your gut is telling you don't go, don't go. Do you want to go? Of course. We all want to sort of get back to that, but it's a combination of. So our advice is on this risk assessment approach. We've seen a lot of events take place very safely. We've seen large mass gatherings event. We've seen the Hajj take place, for example, where you've seen those pictures, before the pandemic, where there's so many people in very close contact with one another, and then you've seen the Hajj take place when people are physically distanced from each other. There's a limited number of people that go. So it's a hard question to answer with a yes or a no. Should they happen or should they not happen? But all of the measures have to be assessed. The event has to be assessed. The measures have to be assessed. And then a decision needs to be made of if it should go ahead, and if it does, what are the measures that could be put in place to keep it as safe as possible.
Thank you, Maria. We are receiving few more questions, and one is about the use of personal protective equipment and how effective it is against the COVID-19.
So it's very effective against COVID-19. So it depends on sort of what you do, right? If you're a health worker, there's certain personal protective equipment that you should be wearing when you are treating suspected COVID patients, or even if you're in a hospital. Not necessarily near COVID patients, but there may be COVID patients. We know that masks, for the general population, masks work. We know that cleaning your hands works. We know that physical distancing works. We know that improving ventilation work against reducing the spread. In healthcare facilities, there are personal protective equipment that health workers need to use. Medical masks, appropriate medical masks, respirators, gloves, gowns, goggles. And then it depends on sort of where you are and what you're doing. But we know that these tools work, but people need access to them. So it's not just do you wear it or not. We need to make sure. So PPE, personal protective equipment, while there is much more supply around the world, it's still not necessarily reaching everybody who needs it most. And there are some countries that are looking at how do they reuse single-use materials. And so we still have a supply issue globally. So it's better. It's much, much better than it was in the beginning. If you remember in the beginning, we did not have supply. And it's different now. But they need people and health workers and individuals need access to these materials.
Thank you so much, Maria. Maybe this is the last question for today. And one of our viewers is asking about post-COVID condition, as many people call it long COVID.
Yes.
Do we have any new knowledge about these symptoms and maybe care that's needed for this type of patients?
That's a great question. Again, we have a post-COVID condition seminar tomorrow that's being hosted by our clinical team and our rehab team and others across WHO. If you aren't registered, we can put the link in the chat, but it's also on my Twitter feed and it's online. The definition for post-COVID condition will also be released tomorrow. I think I had mentioned a few weeks back that it was coming out, and it actually isn't out yet, but it'll be out tomorrow. But we're learning every day about post-COVID condition. We're learning every day about what it entails, what research is needed, how to even define it, and essentially, how we take this forward. But we don't have the full picture on long COVID yet. There are many people that are suffering, and so we hear you. We hear your call for recognition. We hear your call for research. We hear your call for rehab. And we've been working with patient groups. We've been working with lots of different medical providers to make sure that all of that is being evaluated. But our post-COVID, the latest post-COVID condition seminar will be tomorrow. And so if you're not registered, please make sure you register for that.
Thank you very much, Maria, and I'm very glad that Dr. Mike Ryan is here with us. He made it.
Sorry, I'm really, really sorry. I'm unavoidably
No problem.
detained, but no, I could not be here. Just to say hi and hello everybody, and I know you're nearly done, so
wrap it up.
yeah, it's okay. This is the easiest. This is good. This is maybe anyway. It's good to be here.
Thank you, Mike. We very much appreciate your time, and I'm sure that our viewers are also appreciating you joining. We announced your presence, so but we did apologize, and we do understand. But Maria was explaining as well some positive, as much as it can be positive, changes in trends in epidemiological situation, but also what are the challenges. And some viewers were asking about the way forward. So what worries you the most? What are the biggest challenges at the moment for you, and what is the way forward in your opinion?
I think probably our worst enemy right now is complacency, just becoming too comfortable with the situation we're in. I think everyone has understandably wants to get back to the lives which we're doing, back to school, back to college, back to work. And in the countries we see vaccination rates at very high levels, we're clearly seeing that decoupling. I'm sure you've spoken about that, Maria. But that doesn't mean we won't have pockets of under-vaccinated people. And in a sense, this is becoming, in the real impact of the pandemic will be amongst the unvaccinated. So we need to focus not just on making sure we're going back to those people who've been hesitant about vaccine, finding pockets of people, communities who've been missed, individuals who've been missed, and continuing to sell a positive message about vaccination, and persuading and convincing people to get vaccinated, especially in the Northern Hemisphere before the winter period, because we know what happened last year. We know that people will move inside naturally, and we know there'll be more pressure of infection, the more opportunities for the virus to transmit. That's just a given. And if you put together people going back inside with entertainment reopening, then if we have pockets of unvaccinated people, then we are going to have more transmission. I think what's good to see in the data increasingly is that double vaccination or a natural infection followed by vaccination is associated with high levels of protection. And increasingly we're seeing good levels of protection against infection or infecting other people, although it's not perfect. And what's clear in the data is that being vaccinated means my chance of being infected and infecting someone else is lower, but it's not zero. So therefore you still must maintain your vigilance. So even if you're vaccinated and you develop sniffles or you develop a fever, you could be reinfected and you could infect somebody else. So it's about, again, don't assume. The chances are, if you're vaccinated and you feel sick, that it's not COVID, but there is a chance that it is. And in that situation, you need to think about your behavior. If you're vaccinated and you get a fever, you need to get tested. You certainly don't want to go and visit an elderly relative. So we need to think about our individual sort of plan, and you used to say have your strategy, have worked out, have your plan. And I think we just need to readjust the plan in a more open way. We can do more, we can see more people, but we also need to recognize vaccination gives me protection against getting very sick or dying, but it doesn't fully protect me from being infected and then infecting someone else. It does help, but it's not perfect at that. So we can still become, even if we're vaccinated, the vector to spread the virus, and we can reduce that risk, especially in terms of the people we make contact with, especially if we're not feeling very well. So that's how I think we're going to have to adjust, is just changing our behavior, enjoy the lives that people are getting back, but also be not complacent. That's very different in areas of high vaccination from what's going on in countries with low vaccination, where we still see health workers. I mean, I'm amazed, I'm still saying it. Health workers still in low-income countries going to work today in COVID wards who not necessarily vaccinated against this, or don't even have PPE for that matter. So we do need to recognise that there's in some sense the pandemic of the unvaccinated is two kinds. There's the people who are unvaccinated within countries with high coverage, and then there are the countries that don't have the vaccine, and they're two very different situations. So it does mean that those countries with very low levels of vaccination still face high transmission and potentially huge pressure on their health systems. And we've seen that in a number of countries over the last couple of weeks. And again, as we move through the different seasons, as we move through the different behaviour patterns and movements of people, we may see countries becoming real hotspots over the coming months, especially if we can't get vaccination levels up. And that's why I keep saying we need to get vaccination levels up everywhere, because that will blunt the pandemic everywhere, and will reduce the chance of variants emerging. But again, we don't want to be, saying the sky is going to fall in. The Delta variant is a very efficient variant. It could be the most efficient, and we may see no major any variant that's better than Delta. It'll be some variant. So therefore, it's a very high bar. We hope that if we can keep transmission under control, that we won't see the emergence of dangerous new variants. But if we continue to allow the virus to spread unstopped, the chances are another variant could emerge. So it's really hard to predict because of that, because if we had a very stable virus, we could probably say very predictive things right now, Maria, about the future epi, because we know vaccination coverage rates, we know the seroprevalence rates, we know these things, but what we don't know is the variation scenarios. We have scenarios built for that, and there are good case, worst case. What? Am I doing all right? So, but somewhere between the good and the bad, and some of our current situation is way beyond the worst case scenarios that were predicted. So I think it's time for calm. It's a time for a measured government response. It's time for people to recommit themselves to understand that while they're protected and while life is good, and that's fantastic, grandparents seeing their kids back at school is brilliant. But we just need to recommit ourselves to recognizing there's still a dangerous virus around, and that we need to take our best action to continue to drive transmission down. I just hope, particularly, we don't end up where we were last year and see another. It is a roller coaster. Those of you who look at the graphs, it is the nearest thing to a roller coaster. The advantage is this last wave has been that bit lower,
It's going down.
and then we hope but it is a bumpy road to zero, or a bumpy road to finishing this thing. So I think there's more time to go, but I don't want us to be scaremongering or saying everything is terrible. We're going in the right direction. The biggest tragedy still in this pandemic is the inequity in vaccine distribution. It really and truly is. And with that, the inequity in oxygen availability and the inequities in PPE, these are the things that have driven the inequality. But vaccines is particularly stark, given what we see with their impact. And Dr. Tedros continues with partners to drive this message.
Thank you very much, Mike. There was also high interest in treatments and viewers asking about efforts to develop new treatment that could be given early into illness so that we can prevent hospitalizations. And there were some positive news, or maybe promising, from Merck about the antiviral pill that should, according to the company, prevent hospitalizations. So do we know more about it, and what do you think about this treatment?
It's great. First of all, it's the new therapeutic is one that aims at a different part of the sort of life cycle of the virus. So it's anytime you can target different parts of the virus's sort of process, which is great. It's a direct antiviral. It interrupts the ability of the virus to reproduce itself effectively. It basically causes it to create more errors in its code and therefore the viruses that it produces are not viable or not infectious or whatever. So it's an interesting drug. The idea that you can maybe select higher risk populations for severe infection and give them the drug earlier, and then essentially disrupt the virus's plans for that individual by working against the virus is very, very good. But obviously, I haven't seen the raw data, I haven't seen the analysed data, so we need to look at that. I think Merck are going to present that data to the FDA, probably to the WHO and others, and we will see. But anytime we can push back, like pill-based antivirals are sort of a holy grail, because if you can stop the virus before it makes someone very sick, then it's a game changer in that sense. But we also have to be very, very careful in terms of what such a drug is going to cost, and then the cost of treating millions of people early could have a significant cost. And it may be worth that investment, but we have to look at how that's going to work. But it's fantastic in general to see the advances in antiviral therapeutics. This is the way forward. We've got the monoclonal, polyclonal antibodies. Great. We've got what they call immunomodulators, like the corticosteroids. So we've got drugs that directly target the virus by mopping it up. We've got drugs that dampen down the immune response and stop us overreacting. And now we have potential drugs that can interrupt the life cycle of the virus. And the more we have those targets, the more chance we have of saving patients. But we have to wait and see the data. It's great to see it. It's hopeful. And we're seeing other drugs as well, interleukin-6 inhibitors and other things. So we're beginning to see, I think, an acceleration in therapeutic development and potential rollout. But more to look at. I don't know if you've spoken to this, but I think I certainly haven't looked directly at the data on the new drug. But I'm sure Janet and her team are busily doing that.
That's right. We're in contact with Merck, and we're looking forward to receiving the data from them, and then have our independent panel review all of the data. But no, it's certainly good news, and it's certainly good that there's more development and there's more out there. I think everybody wants earlier treatment, so that we prevent people from actually, getting to that severe state and actually dying from the disease. So it's a portfolio. It's a portfolio of tools that we can.
If you're a high-risk person, get vaccinated.
Yes.
Right?
Yes.
Best thing you can do right now is I'm really thrilled we have the drugs.
Yeah.
Fantastic, because there may be people who can't take the vaccine for a given reason, or there are all kinds of reasons. But right now, your best bet, if you have an underlying condition, if you're an older person, if you have any concerns about your general health, get vaccinated. Mm-hmm. And by the way, get a flu vaccine at the same time if you would, especially if you're in the Northern Hemisphere. Get your flu vaccine too, because we're still concerned with the rebound in influenza.
Especially as people start mixing again.
Yeah.
Are you worried about the upcoming, and already we're experiencing cold weather and upcoming winter in the Northern Hemisphere, that it may drive more transmission, and especially with both COVID and flu viruses?
Anytime you have an opportunity where people spend more time together in close proximity and indoors, and particularly with poor ventilation, you're going to have more transmission if the virus is there, whether it's flu or whether it's SARS-CoV-2, the virus that causes COVID-19. So worried, worried, we don't want to sound overly worried, but of course, that's what we do. We look at trends, we look at data, and what the data tells us is that for SARS-CoV-2, for influenza, if you bring people together who are sick, who are infectious, and you have the right conditions, it will spread very easily. We didn't have much flu circulation globally last year because of all the measures that were in place. We had very little RSV, another respiratory virus. We had very little, pathogens that cause, gastrointestinal disease, because people were washing their hands so much and disinfecting surfaces. And so we've changed globally the dynamic of some of these circulating pathogens. And so as we come back together, this is not to scare people, but this is just, we just have to recognize that as we come back together, there is the possibility for the spread of some of these. So if, when the flu vaccine is available in your area, take the flu vaccine. And as Mike said, as we've been saying, when it's your turn for the COVID-19 vaccine, get your vaccine and make sure that you follow the full course. So it's really important that if it's 2-dose, you get those 2 doses. And so, we're very clear on our recommendations on the boosters. We need to make sure that everyone in an at-risk group in all countries receive their first and second doses before large groups of population receive that booster dose. And it's about making sure that we protect everyone that we can, and it's about saving people's lives right now. I think that's the other thing. The urgency that we feel is that we have these tools that save lives now. Not next month, not next year. We have to continue to fight for this, but this can be happening now. We can change the course of this pandemic. We're changing the course of this pandemic with the actions that we take every day. And that has to be consistent. It has to be vigilant. And we cannot become complacent.
I think Maria's right. I think COVID-19 as a disease and the virus as a transmitter will probably settle down into a pattern probably fairly similar to influenza, because as more and more people become immune, or more people have some level of immunity, the virus will tend to maybe be just that bit more efficient in wintertime when people are inside in transmission. So we'll probably see a pattern somewhat like influenza, where you'll start to see a kind of a seasonal pattern emerging. And I think we're going to have low-level transmission of SARS-CoV-2 for a very long time, with seasonal variations and occasional outbreaks or clusters in under-vaccinated people. And it's what we see in many other infectious diseases. And at the same time, as Maria said, flu, we've had a 2-year holiday from flu. Our immune systems have been on a break. We've been fighting COVID-19, but now influenza, as it starts to circulate again, it's really important that risk groups are vaccinated, and if you are offered a flu vaccine or you have an opportunity to get one, please take it, because it is very effective, again, at reducing the severity of infection. It saves an awful lot of lives. But there are other infections like RSV, respiratory syncytial virus, particularly in kids. So, parents will just have to be that bit more vigilant this winter, as they always are. It's just to make sure that we're just aware of the fact that we're, as you said, coming back into contact with some of these natural pathogens again. And it may take a very long time for them to I hope it does, but we just need to be careful. New Zealand had quite an experience with RSV in their winter, and they had quite a rise in childhood cases of RSV. So we just need to, it's not just flu, and it's not just very elderly people with flu. There are other, and pediatricians and GPs and nurse practitioners are on the lookout for that, and they're very aware. And don't worry if you're worried about your kid, just make sure you get them seen by a health professional so that they can make a judgment as to whether further investigation is needed.
Thank you very much. Thank you for your time, and also for this extended guidance that is beyond COVID-19. And I thank all our viewers watching us from Maldives, France, US, UK, Canada, South Africa, Colombia, Brazil, Argentina, Egypt, Italy, Lebanon, Kazakhstan, Bangladesh, Bolivia, Kenya, Malawi, and many others. We also know that some of our viewers on Facebook have been facing difficulties either viewing this or commenting, and we are informed that Facebook still has some difficulties and not all services are fully back. So we hope by next time we are having this conversation that the live feature will be fully functional. Thank you once again, and please stay safe.